In this session, we will be talking about the standard precaution, which are the important basic principles of infection prevention and control that to be applied by all healthcare workers in their daily practice. At the end of this session, we will be able to describe the standard precaution and discuss the need to use standard precaution for all healthcare for all patients, identify basic principles of infection prevention and control at the general. Standard precautions are basic infection prevention practice designed to reduce the risk of transmission of microorganisms from known and unknown source of infection. So, it is important that all healthcare workers must apply to care of all patients regardless of their diagnosis or presumed infection status. What are the elements of the standard precaution that recommended to all healthcare workers? First, hand hygiene, personal protective equipment (PPE), environment and equipment cleaning, clinical waste, linen and spillages, sharp injury prevention and occupational exposure prevention, isolation precaution, and cough etiquette. One of the components of standard precaution is hand hygiene. You have to know that hands always become contaminated all the time because 80% of infectious disease are transmitted by touch. So, the single most effective way to decrease cross-contamination is to wash the hand. There are two types of hand hygiene, and it's important to know the difference between them and when you should do hand hygiene and how. The first one is hand wash with soap and water when the hands are visibly dirty, and it takes from 40 to 60 seconds. The second one, alcohol-based hand rub, when the hands are not visibly dirty, and it takes from 20 to 30 seconds. In this slide, as you can see, the steps of doing hand washing. And this one for hand rub, almost the same technique, just using alcohol hand rub. In 2009, the World Health Organization recommended that the use of multimodal hand hygiene strategy, which is called 5 moments for hand hygiene, in order to improve hand hygiene compliance among healthcare workers. What are these moments? Before touching patient, before clean aseptic procedure, after body fluid exposure risk, after touching a patient, after touching patient surrounding. Personal protective equipment (PPE). This all equipment that is intended to be worn by a person at work, which protect them against one or more risks to health and safety. It is important to know that the employer is responsible for providing PPE. However, the healthcare worker is responsible for wearing PPE correctly. Let's see the sequence of wearing PPE. First, you have to do the hand hygiene, wear gown, wear mask, wear goggles and face shield, and at the end, wear the gloves. The sequence of removal of PPE, you have to remove the gloves first, and then do hand hygiene, and goggles and face shield. Then after that, to remove the gown and mask outside the room. Then again, you should do hand hygiene. Another component of standard precaution is environment and equipment cleaning. All healthcare workers need to know any equipment that is being used by more than patient must be cleaned between patients. Also, all high-touch surface in the patient room must be cleaned daily. Waste management. All waste from healthcare need to be segregated appropriately. And there are different kinds of waste. The first one, domestic waste, such as paper and food, etc. And clinical waste, which is the waste that has come into contact with body fluid. All sharp objects must disposed in the secure container designed for that specific purpose. As you can see in this slide, a picture of different medical waste, which are color-coded bags, to help the healthcare workers to know the difference between them and when should be used and must be disposed when it's 3-4 full. Linen management. All the linen from healthcare need to be segregated appropriately. Usually there is a color-coded policy for the following. Use linens, soiled contaminated linen. Remember, patient bed linens are to be changed daily and as needed. Do not check used and soiled linen when removing it from the bed. Place soiled and contaminated linen in the blue hamper bag, and used linen are placed inside white hamper bags. Remove instrument, needles, or used under bed. Place full and tied of soiled linen bags in the dirty utility rooms for backup by laundry staff. Linen bags must not be placed on the floor. Spillages. Spillages should be dealt with immediately by using spill kit for blood and body fluid spill, and should be used when there is large blood spills more than 20 ml and other biological fluid. You must wear PPE and always follow decontamination policy or instruction. Isolation precautions are used to help to stop the spread of a germ from one person to another. These precautions protect patients, families, visitors, and healthcare workers from the spread of the germ. There are 3 categories of transmission-based precaution with color coded. First one, droplet precaution are used for disease or germs that are spread in tiny droplet caused by coughing and sneezing, such as pneumonia and influenza. So the patient needs to be in the single room, and healthcare workers should do hand hygiene and wearing surgical mask. The second one, contact precaution, direct or indirect, are used for disease or germs that are spread by touching the patient or item in the room. For example, MRSA, VRE, diarrheal illnesses. The patient should be in the single room, and the staff must do hand hygiene, also wearing gloves and gown in this case are needed. The third one, airborne precaution, are used when you have a lung or throat infection or virus such as chickenpox or tuberculosis that can be spread by tiny droplets in the air from the mouth or nose. The patient should be in the negative pressure room, must do hand hygiene and wearing N95 that appropriate for your face, and the door must be always closed. Sharp injury prevention. As you know, healthcare workers can be exposed to blood through needle stick and other sharp injuries.